Let's try once again to speak to Mr. Wayne Duvenage, the CEO of the Organization Undoing Tax Abuse, or OUTA, pertaining to, of course, that SIU interim report on the kind of goings on that has been happening in terms of corruption and misappropriation of funds at the Tembisa Hospital. Wayne, let's try once again. A very good afternoon to you, sir. So safe to say, we have come to know that the rot within the Tembisa Hospital runs far deeper than we've been led to know, with billions of rand lost to fraud, corruption, as well as tender procurement irregularities. Today, in fact, a short while ago, General Khumalo was testifying to direct communication of Vusi Matlala alongside a string of individuals. Also, the SIU report revealing well over 2 billion rand misappropriated funds. Let's get your reaction as, of course, OUTA on these revelations, sir.
Yes, I mean, we are shocked, and at the same time, we're not shocked because we've just become, used to this. It's been, by the way, reported a number of years ago, 4 years ago, when Babita Deokaran was assassinated after exposing a lot of what was taking place then. And Jeff Wicks has done a lot of exposure on what was going on, the type of manipulation. He's written a book on this. That was going on, and yes, now the SIU coming out with its interim report 4 years later, and we're told this is just the interim report. The final report will be ready in 2 years' time, and that's really what worries us because the old adage, and it is a serious matter in South Africa, that justice delayed is justice denied. So much money goes missing in between all this time. People go missing. And we really have a lot of work to do to get up to speed with holding people to account. Absolutely.
I'm sure you heard the Minister of Health there, Wayne, just on that clip preceding our interview, also saying that, of course, this could not have been done without the assistance of officials from high level up within the health department. So very disgusting, that revelation, Wayne, that hospital officials had colluded with service providers in order to inflate invoices and approve payments, funneling these funds then into their personal accounts and luxury assets. Then there were lapses in internal controls and inadequate verification processes, allowing for these fraudulent orders and duplicate payments to go unnoticed. So, Wayne, this should have never, ever be allowed or even be tolerated at this stage. What should be done to bring those to book?
Well, I mean, you're quite right. It should never have happened. In any business, you have checks and balances and oversights to make sure that there's none of this happening. But it is happening. So you'll find that fictitious suppliers get put into the system, 3 quotes that don't exist. It really is shocking that it could have even happened. And I agree with you and the minister saying, look, there are senior people involved, but yet we don't know about them. And again, I just come out of a business environment. You discover this stuff, and within a month you have a hearing, and within a few days the people are dismissed and charged, and then you follow up with the investigating officers. You help build the cases, and you get them into court and you get them into jail. This should take place in a few months. Here we are 4 years later. So it's mind-boggling. But what we do want to see is who are those people higher up the chain? Are they politically connected? Are they going to be protected? And what is actually going to happen to them? We haven't seen enough of the companies, and there are lots of companies involved here. The directors of those companies and the staff involved in Tembisa Hospital. We know that there's a few that have been suspended. This is just not good enough. It is just amazing how long it takes. We need to see a lot of people behind bars and in orange overalls as a result just of this Tembisa corruption that's taken place.
Wayne, let's further unpack that. Of course, the commissioner says there are 207 service providers are currently who they are investigating. That's the SIU commissioner there, and 4,501 of those dubious purchase orders. And of course, something that he is now terming the Hangwani Maumele syndicate, that is, of course, that has 520 million rands worth of assets and 293 million rands worth of properties. But Wayne, how are people able to just accrue so much money through fraudulent means and they are not being brought to account, not even from SARS level?
Yeah, well, exactly. So there's a whole lot of oversight entities I was saying earlier on. SARS is just one of them. I mean, they would have had to bypass all of those and not declare those assets, and so SARS would have to be notified now and pick that up and go after them. But you're right. I mean, how does this happen? These people are just brazen. Let me tell you, the people who've been involved here, this is what greed does. It blinds you to the fact I'm going to get a few million rand in my bank account and it looks easy, but they don't realize there are digital fingerprints all over the place and they will get caught. But it takes the SIU to be able to do that. What should have happened is the minister, the MEC for Health, as Babita Deokaran exposed this, should have taken disciplinary action, should have identified everything, got in investigators and shut it down immediately. And they didn't do that. And now the MEC is gone. She's still got her job, by the way. I mean, I want to know, why is she? Why is she not being held accountable? And others in higher up in Gauteng Health, including Panyaza Lesufi, who should have known about this or did get to know about it very quickly and was very slow to react to these matters. It just the mind boggles. So it's not difficult to manipulate the procurement systems because they are so unmanaged. There's just no oversight. People have a blank checkbook there and they just can do what they like. And it's shocking to see a hospital that only has an annual budget of just under 2 billion rand to have its whole annual budget used up in fraud. And now you've got to ask yourself, what about the other hundreds of hospitals and clinics around the country? This is happening in so many places, and we see it in the skills development levies process, the SETAs. We see it everywhere. There's a plundering spree like you cannot believe taking place, and we have a president who's asleep at the wheel and not saying, not on my watch, we need to tackle corruption and do something serious about it. We are just belaboring this. We are so asleep in this country around the criminal justice system and its repair.
It's quite concerning indeed, Wayne, because then we still are not going to know then who is the mastermind behind Babita's murder at this stage. And quite interestingly, some of these names that have been identified, like Yohangwani Maumela, they've not been arrested. And some of these Gauteng health officials, they're still in office. Wayne, unfortunately, we're out of time. We're going to leave it there. So that is Mr. Wayne Duvenage there. He's the CEO of OUTA, also responding to the SIU's preliminary report there on the Tembisa Hospital corruption report and findings by the SIU.